Commissioner, good evening. During a crisis, information is most valuable, especially for our community members. So thank you for doing this Facebook live stream to inform the community of what the Yonkers Police is doing with this COVID-19 pandemic. So if you could please introduce yourself for our social media viewers.
Sure. So my name is John Mueller. I'm the Yonkers Police Commissioner. I'm really excited about this opportunity to talk with everybody. Obviously, for the Yonkers Police Department, as it has been for the entire country, there's been a lot that we've had to deal with in the last 2 weeks or so. So this is a great opportunity for us to finally catch up with our residents and our public to talk to them about the goings-on in the Yonkers Police Department.
Okay, so let's start. We asked the community to send us a lot of questions, to send us their questions. We received a lot of questions via email and through Facebook and the Ring Network, so we're just going to start going through them.
Yes.
So how has the COVID-19 pandemic affected the Yonkers Police Department?
The COVID-19 pandemic has really affected the Yonkers Police Department. We essentially had to think differently about everything we do and how we service the public. We are engaging in patrol differently. We are engaging in crime strategies differently. We're engaging in how we deploy our officers differently. We are engaging in all of the things that the people at home have to do in terms of social distancing, in terms of frequent hand washing, and then you add on all the things that law enforcement and first responders need, like personal protection equipment and things like that, different strategies and ways to do things. So it's been a very, very busy couple of weeks, and we're learning every day. There are a lot of variables out there. There are a lot of unknowns because this is a novel virus. And, we're just trying to keep up with it. And so we can continue to just keep the YPD out there serving the public, making sure that everybody's safe and they have as much information as they need.
All right, so let's expand on that a little bit. You mentioned that some things have changed. You mentioned patrol. Has anything changed for the patrol in the Yonkers Police Department, the patrol force?
Yes, a lot of things have changed. So patrol is really the backbone of any police department. Specialized units are extremely important. It helps us achieve the objectives that we have in our mission, but patrol is really where the rubber hits the road for the public. That is the officers that respond to your home if you dial 911, or if there's an accident, the officers who respond are patrol officers. So everything that we do is really focused on making sure that they're ready to go. We're appropriately staffed and things like that. So what we've done with patrol, we tried to get ahead of the curve, and we were one of the first police departments a couple of weeks ago to start with issuing thermometers for each precinct. So what we did was we issued each precinct a thermometer, the medical guidance for a fever, which I learned from Dr. Amir Rabadi. There is no such thing as a low-grade fever. You either have a fever or you don't. If you were 100.4 or higher, we would have you go home. So the test was taken out of the precinct, so we didn't bring anybody who might have been COVID-19 positive into the precinct to further contaminate the other officers. So we did that. We closed all the precincts down to the community, and that was a big one too, because again, it's not just about the YPD wanting to isolate themselves from the public. It's that we want to just follow all the rules that everyone's following across the country to slow the transmission of the COVID-19 virus. So we closed all 4 precincts. We did open one satellite location, which is here in our building at 104 South Broadway. We accept walk-ins. If you want to meet with a police officer, there is a spot there. We liked it in terms of design because it's relatively small. It's easy to disinfect and keep clean, and there is a glass partition there. So not only are we keeping the public safe, but still making ourselves available to walk-ins, but we're also keeping the officers safe.
All right. Are there a lot of officers currently out sick right now with the virus?
Unfortunately, there are. We probably have north of 60 officers that are out in some stage of the process. Currently, we have 26 officers that have tested positive for COVID-19. The good news is that we don't have any cases of officers being hospitalized. Like many of the people that have COVID-19 at their age, they're mostly young officers. They're very healthy. They don't have any underlying medical conditions. So in most cases, the symptoms and the actual sickness is fairly benign. Not for all. There are some that are quite sick, having difficulty breathing, but no one as yet, which is the good news, has been hospitalized.
Have any officers come back after having tested positive for COVID-19?
We are absolutely seeing that now, and that's a great benefit to us because we've lost so many to COVID-19. Now we're starting to see those initial cycles of people that tested positive 2 weeks ago, 3 weeks ago, that are now coming back to work to help as other officers go out. So this is a real team effort, and we're seeing, the officers are great. Many of them are young. They can't wait to get back to work. I try to call everybody who tested positive, and what you get from most of the younger officers is they're bored because their symptoms aren't what the symptoms would be for someone over 60, or that would fit the category of someone who had an underlying medical condition like diabetes or respiratory issues. So they want to come back to work, and they are.
So with this amount of officers going out, do you anticipate there could be additional officers going out? Do you see staffing being affected greater, or do you think this is just going to cycle through?
We're going to do the best we can, and we're going to take it day by day. And right now we have a certain amount of officers out. We anticipate more officers will go out. We also anticipate officers will come back to work. And we're going to just do everything we can to limit the transmission of the virus, just like the rest of the country and the rest of the world. We have moved to one-man cars for the most part, so that we don't have those issues of close proximity for extended periods of time, which seems to be one of the ways that this virus is transmitted, where you have two officers sitting in a car. The way we dispatch patrol units is no different. It's just that two officers might pull up in two separate cars as opposed to one set of officers pulling up in one car. So, we're trying to be as agile, situationally agile as we can be, and make sure that we're always prepared, and we're watching how things are unfolding, and how we can change and adapt to make our officers as safe as they can be, as exposure-free as possible, and also to deliver all the police services that our residents in Yonkers need.
All right, so speaking of service, with these changes and the staffing issues, has this affected how police respond in the city, the level of response? Can residents still expect the same level of service they were used to before this crisis?
Absolutely. One of the things we did when we looked at this was we tried to look at the virus, and what the cycle was of sickness, what the cycle was for someone who tested positive. And what we came up with was we felt like a 12-hour tour. Now, currently, ordinarily, we have 3 tours a day in 24 hours, a day tour, what we refer to an early tour, which goes from 4 o'clock to midnight, and then we have a late tour that goes from midnight to 8 in the morning. So there's 3 tours in 24 hours a day. We switched to 2 tours, so now we have a day shift and a night shift. They start at 7 in the morning, they work till 7 at night. They work at 7 at night until 7 in the morning. What that allowed us to do was to give them more time off in between those 12-hour tours. So to us, it kind of meets a number of objectives. One of the objectives is that officers have more time to be home, where they can participate in all the things that the entire country needs to do right now with self-quarantining and limiting social contact and things like that. It comes down to be as simple as this. They only have to go into a locker room twice to get dressed. They only have to go into a locker room twice to get undressed. They only have to get in a police car twice to start their day, where before it would be 4 days on and 2 days off. So we've extended this period where they're at work a little longer each day, but they're here less as far as their time off. So we think that if you look at what's happened in China and Italy and other countries that are kind of ahead of us as far as the cycle and the curve of the virus, we know that this is going to look entirely differently in a month. So if we can kind of just time this out and get through this period with the 12-hour tour, it's going to keep us as buoyant as we can to make sure that we have enough officers on the street, and we do, to take care of all the public's needs, because they need us now more than ever.
All right, so to add to that, we just got a question in on Facebook. What are the plans in case more officers than anticipated get sick?
So we have some flexibility with shifts. We have some flexibility with regard to how we deploy officers. So all those things are at our fingertips. And because we're assessing this every day, we're looking at our manpower. We're trying to project forward based on what happened last week. There's a lot of things that go into this, and we're really trying to be as agile as we can and really look at the analytics and really look at how many officers are out. We have now, kind of a baseline of knowledge that an officer goes out. We know that based on the most recent New York State Department of Health guidance, and that's what we look at in the Yonkers Police Department and the city, by the way, is the two bodies of knowledge that we're really referring to is the CDC, which is the Center for Disease Control, and the New York State Department of Health. Those two entities can give us the best information. So, for example, what we're as far as we're looking at positive COVID-19 cases, the New York State Department of Health came out with something on Sunday, March 24th, I believe it was, or March 28th, I'm sorry, that says if you, from 7 days from the outset of your symptoms, you've self-quarantined for 7 days and you've been fever and symptom-free for 72 hours, you should be able to come back to work. So you have to have no symptoms, no fever, and you have to quarantine for 7 days. So now we're starting to look at that in terms of cycles. Now, everybody is not the same. Some officers may continue to be sick, and of course, we're going to want them to stay home. We don't want anyone to come back that's still sick, and we don't want anyone to come back who's still infectious. That's completely, contradictory to what and counterproductive to what we're trying to do. But if the officer is symptom-free, and in many cases this has been the case after 7 days and 72 hours of virus-free symptoms and fever, they can come back and they can help replenish our ranks.
All right, so speaking of the different equipment and speaking of these issues that you're dealing with, our officers have equipment to deal with these calls? Because you mentioned social distancing important, but police officers can't always social distance. Sometimes they have to effect arrests, and sometimes they have to get physical. How does that change now with the coronavirus pandemic? And
that's the challenge. And that's the challenge for first responders and law enforcement in general, is that the nature of our work is not to work remotely, whether we want to or not. The nature of our work is to be up close and personal with people, and we have to make arrests, and we have to aid people that are sick and injured and ill and all those other things. It's the nature of police work. It's what we signed on for. It's what first responders do. And so as far as the equipment piece, we've been very lucky with Mayor Spano. He's been extremely supportive. He makes sure we have what we need right now. All of our officers have N95 masks, which is the mask that is pretty much the standard for keeping the virus at bay. So an ordinary face mask doesn't work, but the N95 mask is designed such that the particulates that could come out of your mouth through sneezing or coughing will be absorbed by the N95 mask. So that's number one. Number two, we have a Ready mask, which is a one-time disposable mask, which, I'm sorry to go back up, but by the way, the N95 mask can be reused if it's disinfected properly. That's also helpful. The Ready mask is they are all outfitted with Ready masks. That's a one-time use disposable mask that they all have now. So, our officers are great. Our supervisors are great. They're extremely agile. They understand how to handle situations well. And, we have to learn how to do business differently than we've ever done before. This is unique to all of us. Nobody's ever been through this. So, really, we depend on the ingenuity of the officers, the situational understanding of different scenarios. And they're doing a great job. And, to keep themselves to limit their transmission from COVID-19 to somebody else or from somebody else to them.
Speaking of equipment, do you have enough equipment supplies for the officers?
Right now we do. We are always looking. We have a great partnership with OEM, Director Mike Mazziello. He's always looking for new sources of equipment for us to make sure that we have enough. And the key is, too, with this kind of thing is to make sure the officers understand each piece of equipment. As I said earlier, the N95 mask can be reused, but the guidance is you don't want to put it in a plastic bag after you've used it. You want to put it in a paper bag. And there's certain ways to disinfect it properly. So it's not just a question of having the equipment, it's how to use it. And we're making sure that our officers have all that information so they keep themselves as safe and virus-free as possible.
Regarding the police department's interactions with the public, is there anything the public should know if and when they call the police? And is there anything they can do to help spreading the virus if they are dealing with the police? Has anything changed for the public? Absolutely.
What we do now, and we ask the public to do this on non-emergency calls, and if they are able, obviously not everybody is able to do this, but in many cases we will ask the complainant or the caller to come out of their homes to meet us instead of us going up into the apartment. Now that serves two purposes. We don't want to unnecessarily infect anybody, and we don't want to have the officers infected either. We need them to be healthy and virus-free so they can continue to serve the public. So the important thing there is and for the public to know is this is what's going to come out of this whole pandemic is an amazing amount of cooperation between first responders, the public, the health industry, and all the other people that are involved in trying to just get us through this very difficult period. So that's something that the public can do for us. If they're able to come out, our dispatchers, who are doing an amazing job, by the way, will often ask them to come out. They will often ask if they're COVID-19 positive, because we just want to take steps to make sure that everybody is safe as they can be.
You mentioned previously that the precincts were closed. What about administrative services the police department does for the community? Police reports, records, the precincts themselves, even the court system. How is that being affected right now during this crisis?
Well, right now, our building, which is 104 South Broadway, is housed in the Case Justice Center. So we share space with the New York State court system and the Yonkers City Court. What's interesting about this is that the court has completely been shut down. And there has been concerns, and we've done our best to get information out, that if you had a pending court case or you had a court appearance, what we want you to know and what the state court wants you to know is that nobody is looking for anybody right now who may have an outstanding bench warrant. All the cases have been adjudicated until we get through this. So the court has made that decision. As far as our administrative, yes, we've curtailed it as much as we can, again, to limit infection, to get through this very difficult period until we can get back and do the great work that we do. The normal course of business. Right now, it's anything but normal. But between then and now, yes, we have curtailed administrative things like report getting and things like that in an effort just to continue to stem the transmission of the virus.
Can you speak to what else you're doing? We got a lot of questions about how we're keeping our members safe. Can you speak to what else we're doing to keep officers safe, and maybe just explain how the sick process works for officers?
A lot of it is just self-monitoring. You're hearing all these words all the time. Self-monitoring. Do you have symptoms? Are you asymptomatic? What is your, again, the self-screening, I think, was a huge thing for us when we incorporated the thermometer use at the precincts before officers reported to duty. Because you might be asymptomatic, but you have a fever, and that's one of the. I think I recently read that a fever is probably accompanies COVID-19 80 or 85% of the time. So that's a very good indicator in most cases that you might be COVID-19 positive. So that's one of the ways. The other way is we're putting out as much guidance as we can, again, by legitimate places like the CDC and the New York State Department of Health about frequent hand washing, disinfecting of workstations, social distancing between the cops and the public, social distancing between cops and cops, supervisors. For example, we've really had to relearn and rethink and retool how we do business. Ordinarily, our officers fall out and they're given what we refer to as a roll call. So they'll be provided by the sergeants the information of the day about crime patterns, precinct conditions, quality of life issues that they have to address. Can't do that anymore. So now a lot of it's done by the phone. A lot of it's done in the parking lot when they can with the appropriate amount of distance. What we want to do is kind of take the whole COVID-19 pandemic and all the things that the whole world is being told to do and try to retrofit that to how we operate our police procedures. The bottom line is that no matter what happens, we have to be here for the public. We have to be here for our residents. We love our residents, and we're going to be here for them. It's just a question of us all teaching ourselves how to do things better.
So we have more questions that I want to get into from the community. First is, what's the priority for the Yonkers Police right now?
The priority of the Yonkers Police is to be available, as we always have, for our public. If you call 911, our police are going to respond, and they're going to resolve the issue. If you have a quality of life issue, we're going to do our best to resolve it. What we're looking for the public is to recognize that we're in a very unique time. We are in an unprecedented time, so what we're looking for, too, is a little bit of cooperation. Maybe we can, and again, it's all about thinking out of the box. It's all about understanding how we can do a better job. Perhaps a dispatcher, and I know they do this all the time, is able to resolve a situation just over the phone when they call. If you need a cop, if you need a Yonkers police officer, they're going to be there, and they're going to be there quickly and they're going to be there, and they're going to act professionally, and they're going to help you every way they can, because that's what they do every day. This is just another iteration of how, you know, the police departments across the country, and fire departments too, and Empress just learns how to do things differently and adapt with situations.
We have a couple questions from the Ring Network. One of the questions was regarding elected officials in Westchester. Can Westchester residents be placed under a mandatory curfew with the exception of first responders? How would you answer that?
I'm going to defer to the Westchester agency that has that, because we're not, what we're here to do, I like to use this terminology for curfews and things like that. I like to use the idea of persuasion over power. Right now, the effort is not to go out there and find people playing basketball and write them all tickets or have them arrested or threaten to have them arrested. It's about, and again, it's something that we've evolved as a police culture and a police profession, about learning how to get to yes with people without having to use enforcement powers. To explain, like, put it in the context of the person you're speaking to. Maybe there's a group of young kids that are playing basketball and they feel as though COVID-19 isn't a big deal to them because they're not seeing a lot of kids their age infected with it. But if you can put yourself in their shoes and say, okay, fine, you may be asymptomatic and you may be positive COVID-19 and your symptoms may not go any higher than the common cold. What if you infected a grandmother or a grandfather, an elderly person, someone you love, someone you care about, a neighbor? So we need to think about all these things in that context. We're going to get through this better if we just think about each other and not just about ourselves. So yes, we want to discourage those basketball games, but we're going to do it in a way, we're going to try to engender cooperation. We're not looking to arrest people. We're not looking to lock people up. We're looking to engender cooperation through communication.
We have a question on Facebook from Rosemary. She's asking if there's testing available for the officers.
Yes, Rosemary, that's a great question. There is. Because that's a big thing for us, because, again, if they are positive, we need to know it, because we don't want to infect more officers, because we are an essential service and they can't work remotely. We still need officers to come to work, and they are. So, yes, there is testing for officers. There's a great partnership with Westchester County. Phelps Hospital just came online that will test first responders. And that's important because it gives us a little bit more agility to get a test quickly, to confirm someone is positive COVID-19, make sure they get the appropriate time for quarantine, and to be, symptom-free for that 72-hour time frame I told you about, and then they can come back to work. So, yes, that's happening, Rosemary, and yes, we're very grateful for it.
Okay. From the Ring Network, how is the City of Yonkers Police working together and collaborating with adjacent police departments? Has there been an increase in crime in the area, and are we planning, is any planning being done for potential civil unrest? So you 3 questions there now. Okay,
so let's take the first one. The way we're operating countywide is a system called the Multi-Agency Coordination System. And that was designed, and it's run by the Westchester County Police, who are amazing partners. Tom Gleason is the commissioner there. He's a colleague. He's a guy I love working with, I respect. And he and his chiefs, John Hodges, fantastic guy, really, really working hard to kind of bring all the information through this multi-agency coordination system. The short term is MAX. So what happens with the MAX every day is that all the police departments in Westchester County, and there's, I believe, 46 of them, push all their information as far as attendance rates for police, best practices with thermometers, closing down areas and doing social outreach, different things. We're all sharing this stuff. It all goes through the MAX. It's coordinated by the Westchester County PD and the Real-Time Crime Center, who, by the way, are amazing each and every day, not just now with the pandemic going on. And they take all this information, they distill it, and they push it out to all the other police departments. So what the Westchester residents need to know, and Yonkers residents need to know, is that we're working very closely with all the other police departments. And Westchester County PD is the hub for that. They're the ones who are bringing it all together and helping us. So I know, for example, in terms of mutual aid, if I needed it, I know how many officers are now, what the absentee rate right now is, and obviously all of our absentee rates are up, what the absentee rate is for the Mount Vernon PD, or for the Pleasantville PD, or for Bedford PD. And so having this information each day, real time, every day with briefings, allows us to really share information. I mean, this system was set up initially for counterterrorism and for mass casualty events and things like that. We never thought it would be used for something like this, or at least I didn't, a global pandemic, but it seemed to work really, really well in terms of us all talking to each other and sharing best practices.
The second part of that question, has there been an increase in crime in the area?
Luckily, I can say, knock on wood, there has not been an increase in crime. Calls for service are down, and crime is down. We think that our Yonkers residents, as they usually are, extremely cooperative and helpful. I think they recognize that we are in an unprecedented time. So everyone is pretty much staying home. Crime has been down, which makes our life easier so we can be available for medical calls and all the things that happen with COVID-19. As far as the third part of the question, which relates to civil unrest, we are hoping it doesn't happen. We are certainly prepared for it. It's another example of how the MAX system, the multi-agency coordination system, would play into that if there was civil unrest. Yonkers residents, as well as Westchester County residents, all over the county need to know that we're all connected. And so if we need officers, we can get them. If other agencies need officers, they can get us. So it's one of those, the MAX system is really great. I can't say enough about how great partners Westchester County PD has been, and Tom Gleason and his officers. They're really done an amazing job in bringing this all together very quickly, by the way.
Now that people have been quarantined at home for a certain period of time, another ring user is asking, has there been an increase in domestic violence calls during this period?
Unfortunately, there has. There has been an increase of domestic violence calls. I don't think that anybody would be surprised at that. You know, it's a very stressful time for people. You know, we are in a time when, you know, we just don't know what's going to happen next. We can do the best we can to prepare, and we are. We can do the best we can to project when the pandemic is going to crest and then when the numbers are going to decrease. But in the meantime, there's a lot of uncertainty, and I think the uncertainty breeds people being on edge, which in and of itself breeds more domestic disputes. So yes, unfortunately, we have more domestic dispute cases.
We have a ring question. Actually, this question came in from several users. Do we know how many coronavirus cases there are in the city of Yonkers?
I believe right now, as of today, we get a list every day from the Department of Health, and we're somewhere around 500. 500 positive COVID-19 cases. I would remind everybody our city is about 220,000, so that's relatively low. But of course, you know, we're preparing for any possibility, and we expect, of course, like a lot, you know, let's face it, New York, Westchester, New York City, we are the epicenter of this. And, you know, it's a difficult thing to be the epicenter when you don't have a baseline to work off of. Other cities and other regions of the country are going to be better served because we went through this already, and we have a lot of different strategies, things that worked, things that didn't work. For us, a lot of it's new. But we're working day and night to make sure that we have everything the way as best we can be prepared for our residents, because that's really what matters to us.
This question came in from Facebook user, I'm just going to use the initials, QP. Commissioner Mueller, the cops who have their immune system already compromised, what are you doing as a protection measure for them?
So that's a great question. So the cops, and we do, just like the rest of the country, we have officers that do have compromised autoimmune systems. And this is a big concern for us because, as we know, with the COVID-19 virus, people with compromised autoimmune systems are more likely to get sicker. They probably have a higher likelihood of death. So we want to make sure those officers are as safe as they can be. So what we do is, when we know that, and we have a very robust medical control system here in the Yonkers PD, when we know that, and that's brought to our attention, we will do our best to find a different responsibility that or a task they can take up where they can still contribute and help our mission, but they're not exposed unnecessarily to COVID-19 like a perfectly healthy young police officer who's 25 years old is.
Question from Facebook user Caroline. The Office of Emergency Management, what is their role in this pandemic and in helping the residents of Yonkers?
So OEM, the Office of Emergency Management, has done a great job. I think I mentioned him earlier. My Director Mike Mazziello and his staff are fantastic. Most of whom, you should know, by the way, are volunteers. And they are always available to help us. It's not just in the time of this global pandemic and COVID-19, but they're here to help when there's a fire and people are burned out of their homes, if there's a storm, anything, or blackout, they're always here. They've done an amazing job. In this particular circumstance, A lot of what Mike and his team are doing is emergency procurement of equipment. He just got us a sanitizing machine a couple days ago, which helps us sanitize workstations quickly. We know that this virus spreads easily on certain surfaces, so to have that equipment, and more equipment will be coming in, by the way, as time goes on, is very helpful to us to keep our people as virus-free as possible.
All right, we received several Facebook messages, emails, multiple comments regarding social distancing, and I'll just read some quickly. Commissioner Mueller, are you planning on reinforcing social distancing, and how? Commissioner Mueller, what can be done when multiple tenants in your building have confirmed coronavirus? Commissioner Mueller, there was a group of people playing basketball in the park. You touched on that previously. Commissioner Mueller, are you going to act on complaints if they are submitted regarding social distancing complaints? I know you touched on it before, but if you can just reinforce, what's the strategy for?
Absolutely. The strategy is, again, it's persuasion over power. It's communicating the need for people to follow these rules. The Governor Cuomo, has instituted, I believe, it's 10 new executive laws that relate, and it's all common sense stuff that's going to help us get to the end of this and get through this. It's not going to be easy. I know it's uncomfortable for everybody. It's uncomfortable for me. You know, human beings by nature are social beings, so it's a really hard time right now not to do that. And as time goes on, it gets even harder. It's easy to do it for a day. It's harder to do it for 4 days. It's harder for 4 days than it would be for 8 days, and it goes on and goes on. So, again, we're asking for cooperation, and that's what our officers are doing. Our officers are doing a fantastic job. They understand that this is not a time to be aggressive. It's never really a time to be aggressive. It's a time to be understanding, to show compassion, to provide what I really want them to do, and I know they're doing an amazing job with it, is to provide a calming and peace. And understanding this is a really challenging time, in many cases the challenging time that most of us will ever live through. But you can spend your mental energy worrying, or you can spend your mental energy planning and thinking peacefully and thinking about ways to get through this. We know what the virus can do and how it can spread. So we also know how to avoid it. So what we're looking for people is to just follow those rules. You know, it's not the time to play basketball with other people. It's not the time not to engage in social distancing. Most of our restaurants have been fantastic. I mean, McLean Avenue is a perfect example. This hit right around St. Patrick's Day. Huge day for Yonkers, huge day for our great McLean Avenue community. They're wonderful people. It's an exciting day for all of us. The night before, we were concerned that some people, because it hadn't hit too hard yet, that maybe some of the bars might be open, some of the restaurants might be open. We did not have one bar or restaurant on McLean Avenue that was not compliant. They all were doing what the governor's directive was. They were providing takeout, and people weren't in the bars, and they were not engaging in things that would further spread the virus. Great group, great people. We will have a St. Patrick's Day parade coming, and it's going to be great, and we're going to appreciate it more than ever, because now we can't take it for granted because we lost this one this year, but it will be happening again. But it's just that kind of cooperation. What you're going to find is most people, I know that we'll see, unfortunately, there are scams already that we're seeing that we put out on our PSAs about how, people will try to take unsuspecting people about a cure that doesn't exist and take their money. We're also preparing for the scams that are going to be related to the checks that are going to be coming from the government, the stimulus checks, that people are going to try to scam them. We're going to try to stay on top of those scams, get that information out to the public to make sure that the money that they receive from the government they use to take care of themselves and it's not stolen from them. And that's the worst in people. But there's so many more examples of the best in people that we're seeing all over Yonkers in our day-to-day work with them.
So dovetailing on social distancing, we had a couple of questions regarding people congregating in businesses or in restaurants. Are there any tools at our disposal, or is there any enforcement we can do for places that don't follow the governor's order?
Absolutely. We can find the business. We can find the business, and we will find the business. We've done our homework on what the governor's order means, how we can arrive at a charge, and we certainly intend to do that. Obviously, we would prefer willing cooperation. Obviously, we would hope that people would understand what a grave situation we are in and how much that means to have those places closed right now, and to not have people exposing themselves to potential infection, especially our elderly and our infirmed. This is a group that we've seen across, since the virus has taken hold, that are the most vulnerable. So that's what I want people to think about. It's not just about someone who's healthy, who's asymptomatic. It's about people that you may come into contact with that are not healthy, that have an underlying medical condition, and you're really putting their life at risk. And that's why we really need to come together right now and cooperate.
I see a couple of questions on Facebook regarding the homeless population. It was also one of Gail Baxter's, one of her questions as well.
Gail's a good friend of mine. Hello, Gail.
How's COVID-19 affecting our homeless population, and how are we dealing with it?
It's a real challenge because, as we know, a lot of homeless people have one of two issues. They're either addicted to drugs, which puts any self-concern at the back burner. They're more worried, people that are addicted to drugs, unfortunately, it's a chemical imbalance, and they're looking for drugs, and in many cases, they'll expose themselves to COVID-19 situations just because it's not at the top of their list. The same thing goes for the second category of many homeless people, which is mental illness, that may not know enough and know enough to protect themselves. Our officers do an amazing job. We do the best we can with the homeless population. There is no provision for us to take people off the street, nor do we intend to. It's always, as it always is, it's about trying to engender cooperation. It's about passing on communication. It's about making ourselves available and letting our homeless population know what services are available and how we can help. And, sometimes they take them and sometimes they don't. We hope they all take them, and we hope they're all okay. But in many cases, there are underlying conditions with the homeless that make it a much more challenging subset of our population. We care about them as much as we care about anybody else, but it's a real challenge.
Understood. I'm going to follow up with another question from Gail, and I believe Rue Ross from the Yonkers Voice.
Gail can have two.
Mentioned it earlier, is what's happening with the low-level offenders in the modified court service? Are they being released with a desk appearance ticket?
Yes, in many cases they are. That was the case before with recently implemented bail reform. That's a whole other story, and it probably would be another Facebook Live event that we could have. But yeah, we are. We're trying to tread as lightly as we can, and we're getting cooperation from the public. That's what we're looking for. Low-level offenses are ending up with a desk appearance ticket. We don't want to unnecessarily affect a person who's under arrest. We don't want to have that person unnecessarily affect one of our officers, our detention officers who are doing a great job, amazing people that run our detention services division. So, yeah, we're trying as much as we can while maintaining public to tread as lightly as we can to make sure that we're kind of finding that balance right now between limiting transmission, keeping public order, maintaining quality of life, and keeping crime low. Very, very, very delicate balance. It's challenging, and not everything always works out perfectly, but we're trying to balance all of those priorities.
All right, so we're going to give Gail one more question because it also dovetails a question that Reverend Stephen Lopez is asking.
Another great friend, Reverend Steve Lopez.
Gail's asking, now that schools are closed, has there been an uptick in petty crimes that many teenagers commit? And then Reverend Lopez is asking, what are the plans for our Yonkers students who may decide to congregate and not follow social distancing guidelines? And how are you working with the Yonkers public schools? Okay,
so the first question is, are we seeing an uptick in petty crime? And we're not. What the Yonkers residents need to know is that we are assessing this on an almost hourly basis. So we get a rundown each day about the day before the prior calls for service, how many arrests we've had, and all this different data. I mean, we're data-driven, and most police departments are data-driven now. And so we're able to take this data, and normally it's used for crime strategies, but it's also, we can use it to combat COVID-19. For example, great example, right now we're developing where the hot spots in Yonkers are. We don't have the information yet, we don't have the data yet, but the same way I can tell you that there's a hot spot for a burglary pattern. So maybe in a 4-block radius there are 5 burglaries that all fit the same MO, same time of night, same thing stolen, all these different metrics that go into identifying a pattern, we can also use these same skills and transfer them to COVID-19 and know where there's a pattern of COVID-19. Now, what does that do for us? It allows us to make our officers more situationally aware of that these hotspots exist, and it also gives us an opportunity to get out there and say, well, why is it driving here? Are there people out there? Or is this particular playground having more people congregate than other places? And again, it's all going to come down to trying to make the case that this is not the time to play basketball. You'll be able to play basketball the rest of your life. We're going to get through this. We're going to be able to interact with each other. We're going to be able to, continue to be social beings, just not in the next month. As far as Reverend Lopez, we are always, and I'm grateful, Reverend Lopez is not only a friend and a colleague, but he's also one of our police chaplains. He's a great man. He's also on the Board of Education. So we're always working very closely with Reverend Lopez and the other, Dr. Quezada, who is the superintendent of public schools. We are always tapped into them. We have a great communication network ordinarily with student crime patterns, issues. A lot of times if we see something happening on the crime standpoint with kids that happen over the weekend that the public schools may not know about, well, we're on the phone with our public school counterparts and our partners and our colleagues before school starts. If something happens on a Friday or a Wednesday in the cafeteria and we may not know about it, they're on the phone with us, letting us know what might happen after work. We're fortunate that, because we're here on Facebook, everybody's on Twitter, and the kids are no different. So we use these tools to make sure we understand, situations that come up, and so that we can kind of prepare for them and deal with them before they become a problem.
We received a couple of messages, emails, and a message over Instagram regarding quality of life issues. Now that it is springtime and the weather is warming, we're still getting the regular quality of life issues with motorcycles, loud noise pollution, cars speeding on the roadways and the highways. Are officers still going to be addressing quality of life issues throughout the city during this crisis?
They are, but probably on a limited basis, because we have to be available for the big issues. It's not that we're ignoring them. It's just that I really can't wait to get back to loud mufflers. As you know, and as the public knows, when we did our surveys, it was the #1 complaint, I believe, was loud mufflers. And we really took them to task last fall. We intend to do it when this is all over. Obviously, as things arise, we will be there to handle it and mitigate it. I saw one question earlier that someone asked that they hear on the sawmill sirens for some reason from 1 a.m. to 3 a.m. and they're really not sure why. I'm not sure either, but to that person who asked that question, I would say my guess would be ambulances going from Yonkers to the Westchester Medical Center. If I could think of any other thing, I would tell you, but I think that's probably what it is. That's where you're hearing those sirens.
What's your message for the residents of Yonkers?
It's a multifold message. The first message is we're here for you, and we miss you. One of the things that's been so hard about this, because we are a very progressive police department, we are a very community-oriented police department, so much of what our business model is community outreach, and we can't do any of that right now. Stop and Shake is a great program, and unfortunately, the very nature of shaking hands is not something we can do right now, and we recognize that. But we will get there again, and we'll be back there. So the public, my message to the public is, we are here for you. If you need us, we will be here for you. My message is, please cooperate as much as you can. Follow the directives that are put forth by the CDC. It's all going to get us quicker to the end of this if we just all do our part. Let's engage in social distancing as much as we can. Let's wash our hands. Let's try to minimize contact with other people. Let's clean these surfaces. Let's do the best we can. We are going to get through this. That's my message. We are absolutely going to get through this. So many good stories have come out of just the genuine decency of human beings. I have a couple. One is I have to give a shout out to Dr. Amir Rabadi from St. John's. So early on, and I know this happens all over the city and all over the country, Dr. Rabadi reached out to me, just random text, phone call, and all he wanted to know was, John, how can I help the Yonkers Police Department? And again, like I said, there's 1,000 examples of this. Here's a doctor who works in St. John's. They're probably beleaguered right now with COVID-19 cases, in addition to all the other amazing work they do. And here he is calling me, probably in the middle of a 16, 17-hour shift, asking me what I need. I answered the question. I said, I'd like to have thermometers for my officers so they can self-screen. And I'd like to know from you what the medical guidance is from a medical professional like himself, an amazing doctor, what the guidelines would be. Hold on a second, let me make a phone call. Within 1 hour, within less than an hour, he called me back and said, go to this pharmacy, I got your 4 thermometers. That random act of kindness where he just called up and helped with that, it means so much. It does so much for us. Like what he did by just doing that, just a phone call. Like I didn't think to call him. I figured he was so busy. And here he is calling us, made it happen. There's 4 thermometers that we couldn't get. They were on back order. He made it happen, and every officer since that day until now walks in and conducts a self-screening to make sure that they don't have a fever. That's huge. That helps mitigate so much of what could have happened just because of the kindness and professionalism of a guy who's always been a friend to us. Another great example, Robert Rising. Some of you may not know, he owns the company New York City Slab. Fantastic guy. I had a great conversation with him on Sunday morning. Just called up. Now, if you don't know him, go online and Google the Black Lumberjack. He is the Black Lumberjack. He has this amazing company where he makes furniture. Came, again, out of another real challenging time, Hurricane Sandy, when all these giant, beautiful trees fell down, and he started making furniture. We developed a relationship. We both like woodwork, and we're friends. He called up just to say, I have N95 masks. Do you need them? So my message to the public is, I'm grateful for the public. I'm grateful for Robert Rising. I'm grateful for Dr. Rabati. I'm grateful for the thousands and thousands of great people that we have in the city of Yonkers that have just been absolutely amazing in this really challenging time. And it's just a testament to how we can all just pull together. I'm just so grateful for them. The public needs to know I appreciate them. Our police officers appreciate them. And we are going to be there for them.
And finally, department 600 plus members strong. You don't always have the opportunity to speak to every individual. What is your message tonight for your police officers and their families? Well,
first I want to start by my boss, Mayor Mike Spano, and I want to let the public know what an amazing boss he's been for me and for the Yonkers Police Department and for our brothers in the Yonkers Fire Department and Empress. He has assembled a great team. He has a plan. He created a network of communication where we're all talking to each other every day. We're all sharing information. We're all learning different things, and the city is running extremely well under, Mayor Mike's leadership. Amazing leader. So I'm very grateful to him. To my police officers and my supervisors, I could not be more proud of how you're conducting yourselves here. We went essentially from one way of doing things, and one day we snapped our fingers and the world turned upside down. It turned upside down for our public, and it turned upside down for our police department. And nevertheless, through that all, they have risen to the occasion. They have done an amazing job. I cannot tell you how remarkable and amazing you are, how proud I am of you, how much I love you. I can't tell you. These officers and supervisors have risen to the occasion. They've changed their tours. They are going now, similar to what we always say, they go out and they run in the direction of danger when everyone else is running away, and they're still doing this today. They're running in the direction of silent danger. They're running in the direction of unforeseen danger. And yet here they are doing this amazing job with a smile on their faces, nothing but professionalism. And I'd be remiss if I didn't give a shout out to the ancillary units that we have in the YPD, our fiscal services. They're all over and all about, getting us the equipment we need, making those purchase orders run through quickly. That's something that you wouldn't think about, but they are making that happen. Our detention services. Here are the people that have to house prisoners and have to, book prisoners. It's a very challenging environment. Come to work every day, do a great job. Our communications division. Our dispatchers, patient. Calls for service are down, but I'm sure calls are up. They're doing such an amazing job in getting information out and being professional. So all those folks really deserve a lot of appreciation. I can't tell you how proud I am. And I'm also extremely grateful for our brother and sister agencies in the city of Yonkers, our fire department, amazing. I talk to Commissioner Sweeney every day. I talk to Commissioner Meyer from Department of Public Works. We are all working together. We're all in this together. We've built some great relationships. We have a tremendous infrastructure of how to handle this. I know for myself, I've learned so much. I'm going to be better as a police commissioner. Obviously, we're working together every day, trying to be better, trying to learn more, try to understand and be agile. And all these other colleagues and partners are just amazing. And finally, I have to thank our health professionals, our nurses, our doctors. They are just nothing short of amazing. These are people that have taken this job because they want to help the public, they want to support the public, they care about the public, and their care and their love and compassion comes through in their chosen medical profession. We have to thank these folks. They are there in a situation that they're working long hours. They may be short on equipment, and here they are working and making sure that all of us are healthy. We owe a debt of gratitude to the medical profession right now, and not just today of what they're doing, but what they're doing in the future, developing vaccines, coming up with different ways to shorten the testing time, all these different things. Just thank you so much to all our medical professionals. Unbelievable. Extreme. I'm grateful as a police commissioner. I'm grateful as a father. I'm grateful as a husband. I can't say enough about our medical professionals. Thank you.
All right, Commissioner, thank you very much. Thank you for taking the time to speak to the community. We'll be updating this post with some additional information if anyone has any questions or if they want to contact the Yonkers Police.
I miss you guys, and I look forward to getting things back to normal as quickly as we can. More community meetings, more community building, more interaction, just the way we used to do things. Thank you very much.